About your health. Cases of the flu continue to spread at a record pace across the country. The CDC, in fact, warning this is the worst early season outbreak in the last decade.
It's pretty bad. Part of the problem is a low vaccination rate. Our Bill Folsom is looking into the issues we're facing here in southern Colorado. Bill.
Yeah, and we're looking to what's happening locally in Pueblo. In just 2 weeks, they went from 0 to 14 cases. This shows what's been happening in El Paso County. Look at this, 1, 2, 3, 4, where they each go up very rapidly. That's just going from 0 to 50 hospitalizations here in El Paso County. And then we have this next graphic, which is going to look at kind of some things and how COVID has factored into this. This green line was right before we went into lockdown. You can see flu cases and hospitalizations there, but then you come down here and you can't even see it. There's a dark line that's going along here. That's while we were all in quarantine. There was basically 0 flu hospitalizations. Then after we eased things, well, we had a very odd situation with flu happening in May. It rarely happens there. Then you look at what's normal and look over here to this pink line. Well, that's right now. It's been going almost straight up very rapidly, very early.
Right now, this is probably one of the steepest mountains that I've seen probably ever in terms of how fast the cases are increasing.
Flu is currently spreading at an alarming rate.
This year, everything that we're used to seeing or pre-COVID is back. That includes RSV, influenza, rhinovirus, which is the cause of the common cold.
Back, but also showing up differently than what was considered typical before COVID. Dr. Michelle Barron with UC Health tracks the spread of disease.
Post-COVID, everything's been a little bit off kilter, and probably because we were sequestered, also because we had all these mitigation efforts in place of masking and limiting gatherings.
The protection measures lifted, and suddenly immune systems had to get back to work.
Having been exposed in the past sort of retrains your immune system every year, and so not having that exposure, especially in younger individuals, I think that definitely has some impact on why they're getting sick.
Adding to the issue is a low rate of vaccination. NBC was told by the CDC that the current flu vaccine coverage among adults is about 50% of what it was this time of year pre-pandemic.
You can get your flu shot. It is not too late. We don't anticipate that the flu is going to peak till probably end of January or mid to late January.
And the change-up of the disease cycle also shows that the prevention measures during COVID, well, they work. So with flu, also RSV spreading, wash hands, sanitize surfaces, and stay away from others who are sick.